Hello, today is the 23rd. Is it the 23rd? I have to do a bit of calculation. I'm losing track of time. Let me think. Tomorrow is 24th, so yes, 23rd January 2026. It's just like 5 minutes past 6 in the morning. I am in the United Kingdom of Great Britain and Northern Ireland, and this is the daily, although this week has been a bit un unusual, and it has been a bit off and on, intermittent. It has been not regular, but usually I talk to my family members every day via YouTube, which I know is a risky endeavor, but I take that risk almost on a daily basis. So the most recent live stream was, I think, 3 days back, and a lot has happened in these 3 days. Most important of which is the thumbnail for this live stream, which is I have got a laptop for official purposes, and I'm very happy with that. Little progress has been made on the rental agreement as well, and I hope significant progress would happen today, so that one of the most important things that are still left unsorted does get sorted as soon as possible, because I do want to move into a living arrangement where I'm largely the only one living in a place, which I hope that gets sorted today. But it is moving in positive direction, in my opinion, and I hope it is fine. So we will try to set up the housekeeping things. This is not required. We will just go to the participant mode, and this is good. Okay, so please confirm if the audio is good or not, because I always have this fear of the audio not working and I must just be talking to nobody. This has happened in the past, especially when I use a microphone. It just so is the audio good? Audio? How is the audio? I know people back home are incredibly busy, but you could just turn on the channel and do other things. Thank you. Thank you for the confirmation. So it is, I have to confirm the time before I commit to it. It's just 10 past 6, so I have a good, comfortable 50 minutes. Hello, Brahma. Hello, Shumanda. Hello, Baba. So 50 minutes time I easily have to communicate with you. I figured out a good routine for myself. So I have 3 meals throughout the day. One is a breakfast, which I try to get whenever I have some free time, which is not easy because work starts at 8:30 and it goes on till 12:30, and there's hardly any break in between. And the hospital restaurant also opens at 8:30, so it's very difficult to find a break and have breakfast in that. Things are still fairly easy for me in terms of work pressure, so I am able to do it now. Probably I will not be able to do it in future, but I think in future I'll also be able to arrange to have breakfast before leaving for the hospital. Now I have breakfast somewhere between 8:30 to 9:30. Then I have lunch somewhere between 12:30 to 1:30, and I have dinner around 5 p.m. So that is my usual routine. All the meals that are consumed in the hospital restaurant, and that's good. It's not very, it's not incredibly affordable, but it's definitely more affordable than restaurant food. Probably less affordable than cooking myself, but cooking is something I have not yet started. I might in the not too distant future. Hello Ma, hello Rajnath, hello Rajnath. খুব ভালো পূজা হয়েছে, তুমি খুব ভালো দেশলাই দিয়ে ধূপ জ্বালিয়েছো। সে তো আমি তোমাকে রোজই দেখতাম ধূপ জ্বালাতে। বেশ, এবার তোমাদের যা যা প্রশ্ন আছে করো, আমি তার জবাব দিচ্ছি। যা যা এবার প্রশ্ন করতে গেলে হয়তো তোমাদের টাইপ করতে হবে, টাইপ হয়তো তোমরা করতে পারবে না, করতে পারলে করো, তোমাদের প্রশ্নের জবাব আমি দিই। নাহলে সাবস্ক্রাইবার মোডটা অফ করে দিয়ে অচেনা ব্যক্তিদের অচেনা প্রশ্নের সম্মুখীন হওয়ার সাহস দেখাই। মাম এখানে কমেন্ট করেনি কেন? মাম মাম কেন কমেন্ট করেনি? মাম নেই এখানে? বুড়ো আমার কোনো প্রশ্ন আছে? Okay, so I will tell you a story which is, let's imagine it to be fiction. রাজনাথের এই কথাটা হয়তো খুব আমরা সবাই করেছি, রাজনাথ দেখা নয়। হ্যালো মা, হ্যালো হ্যালো হ্যালো। মা তো অনলাইন আছে, মামের কথা হচ্ছে, মাম। काकीमा बिजी है, ठीक है। माम कहाँ है? माम সি মা অ্যান্ড মাম অনেক প্রশ্ন আছে, এখানে করা যাবে না। হাই ফ্রম মাম, ভেরি গুড। তো মামের কোয়েশ্চেনগুলো ট্রান্সলেট করে দেবে। কলকাতা থেকে ফোন আসছে। হাউ উইয়ার্ড ইজ দ্যাট? ওকে ফাইন, ঠিক আছে। কালকে আমার একটা, মাই ফোন ইজ নট ওয়ার্কিং, দিস ইজ হোয়াট মাম ইজ সেইং। ওকে, গট ইট। তো কালকে আমার একটা ওয়েবিনার আছে যেখানে আমি বক্তা, আই এম দ্য স্পিকার। হ্যালো মাম। তো আমি সেখানে বক্তা, সেই পিওরলি ইএনটি রিলেটেড টপিক। তোমরা শুনে বোর হয়ে যাবে, কিছু মাথায় কিছু বুঝতে, যদিও আমি সবসময় আমার প্রেজেন্টেশনগুলো এমনভাবে বানাই যাতে সবাই বুঝতে পারে, যারা ইএনটি সম্বন্ধে কিচ্ছু জানে না তারাও বুঝতে পারে। কিন্তু এই প্রেজেন্টেশনটা লাস্টলি ডাক্তারদের জন্য, তো কিছু কঠিন শব্দের ব্যবহার নিশ্চয়ই হবে যাতে তারা আমাকে ডাক্তার মনে করে, জাস্ট ফর দ্যাট। Okay, so mom asked me a question. I feel I did not answer it, did not upload it because I am still not fully informed about the situation. I've only been here for little over a month, and I've been working for little over 2 weeks. It's too soon for me to give my opinion about something that I probably don't understand fully. I don't probably have all the information. So that is why I did not upload it. As I get more understanding of the situation, maybe in future I will upload it. I don't want to get biased and come to premature conclusions, which may be completely inaccurate. Mom's phone. It's a very general video, I know. It's a general video. But still, I would know what I'm talking about, even if the listener would not know. It's a general video, but the impulse or the stimulus for making a video like that was because I was thinking about certain things and how the difficulties in the path that I might encounter. But to make a video about that before I encounter those difficulties is slightly premature in my opinion, and there will be a lot. That video, that script exists, and I will not forget it in a hurry. So um, I might make that video in the future, but not right now. This is not the right time, in my opinion. Yeah, I don't know if it's good advice. That's the problem. I know they are my views, but I don't know if this is good advice. And I do understand that there is a section of society, probably 10 people, who are inspired to move to the United Kingdom due to some things that I have done. I don't want to um, tell something that would discourage them just because I might feel that it is not a bed of roses, but nothing really is. Now, I want to tell you a story that one of my subscribers told me. I don't know how many of you remember this, but I had made a video where I had documented the walking path from Marriott Hotel in Glasgow, where I had stayed, from Marriott Hotel to Royal College of Physicians and Surgeons of Glasgow. It was just a video where I was walking from Marriott Hotel to Glasgow. And I must reveal the trick here. That video was not shot while I was in Glasgow. That video was shot using Google Maps. And I think I disclosed that in the video as well. So I didn't think that would mean anything to anyone beyond me or to people who wanted to find out how my stay was. But somebody else later went to Glasgow alone, saw this video, and told me that the person did not feel alone. It was almost like I was walking with them. So I don't claim that my videos have a lot of value, but they do carry immense value to some people. So with that knowledge, I have to be very careful about the things I talk about in the video form. Those are my thoughts, true, my views, but I think they require more time to be taken more seriously. Um, so I will give myself more time to come to a proper conclusion, and then those views will be aired. Yeah, I think. See, I don't doubt whether they were well framed thoughts or not. They certainly were well framed thoughts, but I don't know if they were the accurate thoughts. You know, I might, there are something which are acquired taste. Today I might, yesterday I had sparkling water for the first time. I hated it. But maybe 1 month down the line I might like sparkling water. Sparkling water. It just spoils water, I believe. But anyway. So that's about that. Now you can ask me questions and I will answer them. I still have, let me see, I still have a good 40 minutes. 40 minutes to answer your questions. Also, yesterday I went to the hospital walking, and I left 40 minutes after my usual time of departure. Yesterday I left at 7:40 a.m. and still I was the third person to reach the department, which is something I'm quite proud of. I don't intentionally try to reach earliest. I just don't want to be the last person to enter or be late. I can be the last person to enter as long as I'm not late. So yesterday I left 40 minutes after when I usually leave, and still I didn't take a taxi, I walked, and I wasn't late. So I was quite happy with that. Yes, thank you. Thank you. So yeah, I can make a video like that, a completely allegorical video. I can make a video in that way, a slingshot form for video, without really spelling it out what I'm talking about. I can do that. But some things I like. Some thoughts just occupy space in the brain, and I want it on paper or I want it typed. So I did do that. And now with having a channel, I sometimes think I should read them out as well. But I there are many such videos which have been unreleased. I've written the script, but I have not recorded them. Sometimes I've recorded them and I've just not uploaded them. That has also happened. Um, but yeah, so these are things that hold. There are apprehensions I have, inhibitions, which really do not let me take bold steps. Although I don't think there's anything bold about that, but I just am a little unsure of whether those are correct opinions, and as long as I'm not sure, I will not air them. Yeah, I know. So I know that today, if I say that a certain thing is very good, most people will not believe it. They will just come to their own conclusion. But 2 or 3 people might. And I don't want 2 or 3 people to believe something is good when I don't know for sure if that is good or not. And that's the only dilemma I have. I know it's maybe a silly thing, but I just don't want to say something which I know for I don't know for sure is true. Okay, so let us move on from this. Do you have any other questions on any other topics? It is still, there is at least 35 minutes time that I can talk to you. Shumanda, Shumanda Kamal, Shumanda. Apologies for that. Coughing with a mic on is not a very pleasant experience for the listeners. Last 2 days, last 2 days I was observing people. I went to the operating theater for the first time. It's very different. The theater complex is very different. Everything that I know about theaters is vastly different from what I'm seeing here. The changing rooms that I have seen in all the hospitals I have worked in is very different from the changing room I've seen here. It's almost like I've seen these changing rooms in movies with locker rooms and a huge space, but it's a fascinating experience. There are many theaters. The patient experience in the theater is also quite different from what I have seen in the hospitals that I have worked in. Even the wheeling the patient in, wheeling them out. That's also not um, as I have seen in India. The surgery itself, I am familiar with in terms of how to perform the surgery, But the way it is performed here is slightly more. I won't say it's better or worse. I think each technique has its own advantages and disadvantages, but it's different from what I have seen. So it will take some getting used to. I was not doing the surgery, I was just observing it. And I understand that for the first few months I will just be observing, which is good for me because I need to get familiar with the methods used here. That was one new experience. Um, I did sit in the clinics also. Again, I'm observing how people are working. Mostly in this period of my contract is known as the shadowing period, where I'm shadowing different people and understanding how different things are done, and things are done quite differently here, which is something I need to get used to. The behavior, okay, so let's talk about that. Um, so here the system is that patients are given not just a date of appointment, they are also given a time of appointment. And from what I have understood, if there is an emergency, they can always go to the emergency department of the nearest hospital. But if they want a routine evaluation, okay, now a patient doesn't know what is an emergency and what is not an emergency. So whenever they think it is an emergency, they can go. They have every right to go to the emergency department, and the emergency department people will decide whether it is an emergency or it is something that can be dealt with uh, in a more planned manner. So if it is a planned visit to the hospital, they have to go through the general practitioner, GP, which is in India, general practitioner is a name we use for people who have not specialized, who have started practicing after MBBS. But in the UK, general practice is also a kind of specialization. You need rigorous training to become a general practitioner. So you can't really go to an ENT specialist directly. Either you go through emergency of a hospital or through a GP. So the appointments are always routed through someone else. It's never directly. So I feel like going to an ENT specialist today, I can't really do that. Well, I can because I know so many of them, but I can't really book an official appointment. I can meet them informally, but not as a patient. If I have to meet them as a patient, I have to go through a GP. What this results in is that the day before my clinic, if tomorrow I have a clinic, I have to sit in the OPD, I know how many patients are going to be there, and I know at what time each patient is supposed to arrive at the hospital. So if I have 10 patients, I know that patient 1 will is supposed to arrive at 9 a.m. Patient 2 is supposed to arrive at 9:30 a.m. Patient 3 at 10 a.m. So the common uh, fear that patients have had, at least in my experience, is that how long will I have to wait? So two patients usually are not having the same time slot, and each patient is given half an hour time, which I feel is a um, good allocation of time to them. And there are multiple doctors in the hospital, in the clinic, so there are many people to help you out. So now each patient, the attempt is to not keep each patient waiting and to give each patient adequate time for evaluation and consultation. So but even in all this, patients can get missed, and something like that. If it happens, then there are many people in the hospital, in that area, in the clinic area, who notice that, and they tell the doctors that there is this patient who you may have missed, and the behavior is impeccable. They don't um, they know very well how to manage stressful situations. So, behavior is key. I feel this can be a system that can be implemented in India. That instead of saying that ডাক্তারবাবু ৫টার সময় বসে, you tell them that you come at 5:30. But obviously uh, there is an expectation of punctuality from both sides. You want the patient to be punctual, you want the doctor to be punctual also. This arrangement fails when there is an absence of punctuality. Hello, Pavanji. No, I have not. But then that is something which is possible everywhere. But I have not. So one of the good things or difficult things about ENT is that we, as a specialty, we get to see people of all ages, from the very people in the advanced ages and people who are quite young. I have infants as well as people who are more than 90 years old. The entire lifespan of a human being can be encountered in a single day in an outpatient clinic. So we need to have different skills and different in terms of communication as well as in terms of examination. We need to have different skills when we are dealing with different patients, and that is something which I feel I had learned in India, but here things might be slightly different, and I hope I will be equal to the task when the opportunity comes. But I'm just observing how others are treating patients now, and I think everyone is doing a magnificent job. Not just the doctors, I feel even especially the nursing staff, they are really good here. Really, really good. For instance, this is something I have never seen in India. So if there is a patient who is admitted in the hospital and has been sent to or has been brought to the outpatient clinic for evaluation, usually the person who brings them to the outpatient clinic takes them back to the ward, to the inpatient department, and it is coordinated among the nursing staff. But I've never seen in India an outpatient clinic nurse taking the patient to the inpatient department himself or herself. That's something which is I have not seen in India, but I've seen it here. I was quite happy to see that. There is no difference actually. I think I've said this once in one of the LinkedIn posts. I think the cleanliness that we see in private hospitals in India, big private hospitals in India, is similar to the cleanliness I have seen in the hospital I work in. Those hospitals back home in India are also very clean, and this hospital was also very clean. Private hospitals in India, the problem is affordability. If you don't have good insurance, you can go bankrupt. In the NHS, that fear is not there because at the point of use, at the point of care, it is free. So in that way, NHS hospitals are similar to government hospitals in India. So NHS hospitals, I feel, are a combination of the cleanliness of Indian private hospitals and the affordability of Indian government hospitals. So in terms of cleanliness, in terms of service, I think Indian private hospitals are really good, and the NHS is as good, if not better. And in terms of cleanliness, I think Indian private hospitals are also very clean. The NHS hospitals are also very clean everywhere, spick and span. And in terms of affordability, Indian government hospitals are very affordable. I've seen that myself. I've worked in Indian government hospitals through the majority of my professional career. And the NHS, of course, is free at the point of care. So I think it's a very nice combination of affordability and cleanliness and good service. Yeah, yeah, that's what I'm saying. That in big hospitals, a lot of focus is given to service, to the patient experience. Patients should not feel uncomfortable in any way. Although nothing is 100% comfortable about staying in a hospital, nobody goes to the hospital while they are feeling comfortable. Even if it's a psychological problem, that's also a serious source of discomfort. So nobody is at the hospital feeling 100% comfortable, including, I believe, the doctors, because they do a difficult job on a daily basis. But the objective is to make it as comfortable as possible. And that is something which is done in many big hospitals in India, and it is also done in the hospital I work in right now. I think it's true across the NHS. Hello, Pavanji. I don't think we call them sister. I don't think we call them sister. I've not noticed this. I'll notice this now. I don't think sister term is used here. I don't think so, actually. I don't think the term sister is used. Probably nurse is the term that is used. Also, it's very important here. This is an initiative that was started by one of the doctors here. Here, it is almost mandatory to introduce yourself to the patient. You have to tell the patient. This is something I knew from my MRCS exam preparation also. Whenever you are interacting with the patient, it's very important to introduce yourself with your name. You just don't say, I'm one of the doctors here. Obviously, you have to tell them that you're one of the doctors there, but you have to show them your ID and tell your name. Because it's very important for the patient to understand who they are talking to. You don't want them to be assuming. They might not be able to remember your name, but it is very important for you to introduce yourself. I think they just, so usually what happens is they introduce themselves with the name and they generally call them by their name. I think so, but I will keep an eye on that. It's an interesting question. I will pay attention to it. So only mom is asking questions. This is strange. What has happened to the others? Have they all disappeared? This is one of the reasons why I feel a little upset about this. Nobody else has any questions for me. Only mom is asking questions. What are the others doing? Anyway, you have not asked any questions. What question have you asked? Anyway, you can continue asking. Mom can continue. Ma can also continue. Baba to kishi boleni. Buddha Mama has said that he does not want to say anything here. There are only two people watching. I think I'll open the chat up to Baba Gone, okay? I think I'll open the chat up to anyone, then maybe I will get some nice comments. Okay. Anything else? No? Okay, then. I think you have exhausted all your questions. If there are no more questions, I will take your leave, although I still have a good 20 minutes. Yes, the cough is still there. The cough won't go away completely. How am I carrying myself? I don't know how I'm carrying myself. I don't know. It's just every day is a learning experience. I don't know. Yes, I did. I did. I have that every day. So you don't need to ask about that. I have it every day. I hope you will not ask about brushing my teeth, because if you do, I'll say, yes, I've done that also. I think I think back at my time when I'm here, I can't help but always think about the time I spent in um, when are you moving to new house. So a little bit of paperwork is left. That is the only thing. So one of my colleagues has agreed to be, not colleague here, but colleague elsewhere, has agreed to be my guarantor. And he's also working in one of the hospitals in the United Kingdom. He has been sent via email the guarantor form. He has to fill it in and send it back to the landlord. Once that is done, I think it will just be a question of me paying the deposit money and I'll be able to move in. The scheduled commencement date of rent is 2nd February. Today is 23rd, so there is still time, and I hope it is completed today. I hope to receive confirmation from the landlord that they have received the guarantor form in the way they expect it to be. And once that is done, I would be very, very pleased. Although I know that moving into a new place will bring with it its own set of new challenges, but that has always been the goal. It has always been the goal to have a rented place to myself, and quite frankly, uh, even if I had stayed in hospital accommodation, I would have had to move out within 2 months. And if I'm moving out to a rented accommodation on 2nd February, I will be moving into a rented accommodation well within the 2 months window. So that's about it. I don't understand what mom means by she is pleased by the way I'm carrying myself. I don't know how I'm carrying myself. Yes, I have renewed my stay here till 18th of February. But if the rental place is available earlier than that, I will move out earlier than that. I can always move out before the last date. I don't think it is prohibited in the contract to be able to, I can always move out. Staying beyond the agreed period is not allowed. Moving out, if I want to move out today, I can move out today. There is no harm in that. This is not a prison. And I would appreciate if you don't use the name of the place. Privacy concerns. I don't know. And I don't want it. And so there are contractual obligations, of course. As per the contract, I will get the deposit money back. But when I leave a hotel, I usually don't get the money back. So I will not be expecting that here either. But we will have a conversation about that. If they do, I will be very grateful. But they are not supposed to do it, I think. So I'm not going to press for it, of course. And today is Friday, which is the official beginning of the weekend. One of the things I'm still not used to is the fact that Saturday, Sunday, both days are official weekend days. In India, Saturdays were working days. That's not the case here, which is something I like. I also like the fact that in every clinic day you have a fixed number of patients. You don't know, you don't get into a situation where you don't know how many patients will be there. In India, we had days when there were hardly any patients, especially during festivals, and there were days when you just didn't know how many patients were there. You just lost count. Here it is not that. Here you have a fixed number, and that you are supposed to be responsible for. You have a list. In India, we did not, as doctors, we never had the list. The list was always with someone else. We were always supposed to, we were just looking at the time, and sometimes time would fly when it was busy, and sometimes time would be slow when it would not be busy. That's very different here. Here there's a list, and you have to ensure that you are doing justice to the list. So one thing is common both in India and here. You are not supposed to make mistakes. You are. People will make mistakes, but your goal has to be to provide the best possible care to the patient. That is universal, I think. Yeah, I will try to show you the outside tomorrow. That is one of the things that's on my mind, that I will, even if if it's difficult to do a live video outside, I will try to do a recorded video from outside. And then maybe you'll be able to get a good view of the place where I've stayed in for almost, definitely more than a month. So I'll do that. I'll do that tomorrow. Okay, I think I will end the live stream now, unless you have any more questions. Okay, if you have no more questions, then I'll end the live stream now, and I'll start my walk to the hospital. Okay, bye bye. Bye bye. I will try to see you tomorrow again, same time. Bye bye.